Hi everyone. So my name's Marwa. I'm the research fellow, clinical research fellow. I think I've met some of you in clinic, but for some of you, I'm meeting you for the first time. So what we thought we'd talk about now is a more around lifestyle, diet, exercise, things like that. I'm going to start with talking about some medications, but I'm not going to give you lots of scientific information about the medications. We're just going to talk about how to live well with medications. So a little bit about maybe common side effects and a few rare side effects and how we can manage those. So what you can do to reduce those side effects at home. And what we do to monitor you. So I'm going to start with mixilotine. We've already heard how effective it is from Dr. Vino earlier today. And some of you may be on it and responding well to it, but you might have noticed one or two side effects. And these are some things that you could do yourself to try and kind of reduce those effects. So some of you might have noticed some heartburn, and some of you will write into us about reflux or heartburn. And if you're not already doing this, what you can do is you could take it with food or take it after a small snack or food, and that might reduce that. Drink lots of water with it. And then other things that could be causing the heartburn or worsening the heartburn are things like extra caffeine if you drink a lot of coffee, alcohol, or really rich, spicy foods. So you could also try and reduce those a bit. If the mixilotine is working well for you, but you're having reflux, you could try and reduce some of those other things that cause heartburn. Sometimes either us or your GP might recommend antacids like a Reni or a PPI, and they're available over the counter, but if you're taking a lot of them or taking them regularly, then do tell us or your GP about that. The other thing some people have told us is poor sleep. So some people have noticed a change in their sleep with mixilotine. What you can do to try and reduce that is avoid taking it right before bed. So maybe take it a couple of hours before bed instead, and you probably don't need it while you're asleep overnight as much anyway. Other things are the obvious things that we're all told about sleep hygiene, like not using your screens right before bed, making sure your room is a bit cool and nice and dark. Things like that might help. And then some people have been telling us they get headaches as well. So if you do have things like migraine or headaches all your life, then avoid the triggers that you already know about. Things like alcohol can really trigger headaches. As much as you can, obviously, try and get rest and lots of fluids. If they're only once in a while, then you can just take simple painkillers like paracetamol. And obviously, these are common side effects, and presumably the medication is otherwise working well for you. But if they are becoming a problem or you can't get on top of them with these simple actions, then just let us know. And you've heard there are alternatives now to mixilotine, so we can always look at one of those for you. A lot of you will know you get regular ECGs, and that's because there is this uncommon or rare side effect of a change in your heart rhythm. So that is why we do those regular ECGs. And a lot of you already know about that, but I know some people might watch this back online. So that's why we're asking you or your GPs to do that. But we haven't seen much problems with it, but just to keep an eye on that. The next medication I'm going to talk about is lamotrigine. So again, we heard from Dr. Vino about lamotrigine, how it's working as well really as mixilotine and is a really good alternative. You know that the important thing about this medication is it has to be increased very, very slowly. So you might notice that you start on a tiny dose. You might not notice it helps straight away, but after a while it'll start to kick in. So if that's working well for you, but you're having some side effects, here are a few things that you could do to try and avoid those. So for headache, very similar. Rest, fluids, avoid other headache triggers like alcohol or missing a lot of sleep, and then simple painkillers if it's only once in a while. Some people notice some shaking or some tremors. Let us know about that, because we might just change your dose, either lower your dose a little bit, change the timing of your dose, or if you're on a low dose and you're increasing, we can just do that a bit slower. It doesn't have to be every 2 weeks. We can increase it much more slowly and let your body get used to it. Some people might notice they're a little bit drowsy or sleepy. Again, that usually improves in a couple of weeks, but let us know. Again, we can change the dose, the timing, or how quickly or slowly we increase it. And that might just mean your body gets more used to it, and then we can go to the higher dose. Obviously, avoid driving if you are getting sleepy or drowsy initially, and then hopefully once that wears off, you can go back to safely driving. And then nausea, again, take it with some food or avoid rich, spicy meals, other things that might trigger nausea, and let us know. You'll know that when you started lamotrigine, or for anyone watching back online, we'll always warn you about this rash. So mild skin changes can be common, but if you get something like a red or purple rash, or if you have any other flu-like symptoms, that could be serious, so let us know about that. And it might just mean it's not the right medication for you, or we need to increase it very, very slowly. So do tell us about that. That's the kind of warning with that medication. It's obviously most likely in the first couple of weeks when you first start it, or if you stop and you stop for a couple of days, just let us know, because it might mean you need to restart on a lower dose and work back up rather than just going back to the same dose. Say you miss it on holidays or something like that. And if you're newly starting on lamotrigine, or you're increasing your dose, try not to try out new lotions or potions around that time that might also cause a rash and confuse things. And let your GP know you've started a new medication, and they might put off any other medications for a couple of months so we don't confuse what's causing the rash. So those are kind of prescribed medications. Magnesium is something that's available over the counter, and it's available in a few different forms. So you can take tablets. They help with muscle relaxation and stiffness and things like that. They can also help a little bit with sleep, magnesium tablets. Now, the main thing with that is some people might notice they could be a little bit stomach upset or a little bit nauseous. And what you can do is just divide up the dose. Take a little bit in the morning and some later in the afternoon. You can also use lotion if you don't want to add extra tablets to your life. You can use lotions where the muscles are most painful, so maybe that's in your calves or wherever it may be. And you can use that multiple times a day. And again, it can help relax the muscles before sleep. And a lot of people, top tips from all of you, have been things like a warm bath with magnesium salts. So you've got that warmth and you've got the magnesium to help relax the muscles, particularly maybe in the colder weather. The next medication I'm going to talk about is more for the periodic paralysis symptoms, and it's acetazolamide. And it helps to prevent how frequent your attacks might be or how long they might last. It is effective in a lot of patients, and if you are getting some bothersome side effects, this is what you could do to try and help before stopping it, or before we need to look at other options. So again, nausea, do take it with a meal or a snack, drink plenty of water. A lot of people report pins and needles, and that might worry you if you're not expecting it, but it can be common and normal if you start acetazolamide. Usually it'll improve, but if not, we might change the dose you're on, we might reduce it a little bit, change the timing of the day, or move the doses further apart. So let us know. Fatigue or sleepiness, similar to what we said before. Sleep hygiene usually wears off after a couple of weeks. I think it's gone missing from the slide, but usually your body gets used to it after a couple of weeks and it isn't as bothersome. But obviously don't drive heavy machinery or anything like that if you're drowsy. Change in taste, again, that could be really worrying if you weren't expecting it, but that is quite a common side effect of acetazolamide. Again, it might improve after a couple of weeks, or we might change your dose if it's really bothersome. If it doesn't bother you, it's not a sign of anything more serious. It's just quite common with acetazolamide. I've got nausea there twice. This slide has gone a bit haywire. And then kidney stones are the one thing we do warn you about. So your GP might do ultrasounds of your kidneys to see if you have kidney stones even before you start, or if you're prone to them, and to keep an eye on you while you're on the treatment. So let us know if you have a history of them. We might choose a different medication for you, and drink plenty of water to essentially clear out the kidneys. One thing I don't know if we always mention, but something that's important with acetazolamide, is it can make you a little bit more sensitive to the sun. So definitely wear sunscreen. We should all be doing that anyway, but a hat, sunscreen, cover up in the really good weather, which is obviously not as common here. But if you're going on holidays. Some of you might be taking potassium, and obviously too much of that can cause a high potassium. That sort of goes without saying. So discuss how much you should be taking with us. Don't just sort of bump up your dose yourself. Let us or your GP know, and have potassium checks regularly with your GP. So it does work really well. It helps people come out of attacks, but if you're getting some side effects, that might be things like stomach cramps, nausea, diarrhea. If it's a regular problem, you might be taking too much, or you might be taking your doses too close together. So let us know. We can help you adjust that, or we could consider alternatives for you. Maybe it's not the right one for you. Also, we have had some emails from some of you that you're having some difficulty finding it in your local pharmacy. So let us know. We can probably supply it in the short term from here, and then we can try and liaise with pharmacies to figure out if that's becoming a problem with things like Sandoz. So those are the main common medications. Some of you are going to be on other medications that aren't as commonly used, and let us know if you're having any problems with those, and we can advise you. So the next thing we were going to talk about is dietary triggers, and this is going to be a little bit interactive. So if you can connect to the Wi-Fi in here, it's the UCLH guest Wi-Fi. Maybe you could do that while I start talking. So this is an important part. If you're on medication and you find you're still getting some symptoms or some attacks of weakness or things like that, it might be that we can adjust other things in your lifestyle, like your diet and your exercise that Sarah will talk about, to help reduce those symptoms. So obviously we're all still told the general healthy eating guidelines, and we're given lots of things, how many vegetables you should eat, how many of this and that. But the main thing is to have a bit of variety in your diet. Make sure you have different colours on your plate, and in general that's a good rule for having a healthy meal. With channelopathies, we have some special considerations outside of what the kind of general guidelines are. And those apply to things like potassium, how much potassium is in a food, how much carbohydrates are in a food, and then obviously alcohol. Some of you might notice you can trigger either worse symptoms the next day or episodes of weakness with alcohol, and if that applies to you, then obviously you might need to plan ahead if you're going to have alcohol. So for high potassium attacks, obviously we know that you can have attacks triggered by meals containing higher levels of potassium with hyperkalemic periodic paralysis. Some people might be able to identify specific triggers and others might not, so you're all going to be individual. And so a food diary might help in the first instance. You might record what you're eating for a couple of days or a week, and then you can discuss that with Natalie or Albert or one of us. It's important you don't need to avoid potassium altogether, obviously. You don't need to avoid all high potassium foods. It might just be sufficient to reduce some of that if you do notice you're still getting a lot of attacks despite some treatment. It's important to ensure that you don't cut it all out, as potassium is part of normal body function, of course. So what we're going to do now is a quick quiz to see how much we know about potassium in foods. So the first question is, which of these foods has more potassium, a banana or an apple? So we're going to start with one a lot of you might know.
Is it a trick question?
There's no trick questions. A banana or an apple?
Banana.
Okay, so most people are going with banana,
Yeah.
and the correct answer is banana. Very good. Now the next question, so they get a little bit trickier, but I'm sure you all know the answers. Which of these foods has more potassium, rice or a baked potato? So you've got white rice or baked potato.
I think rice.
We've got some for rice, some for baked potato. Some change of minds. Yeah, so this one is a little bit trickier actually. It's hard to know because they're both sort of sides, both kind of carbohydrate type foods. 100 grams of each. Okay, so the answer here is baked potato has almost 3 times as much potassium as rice. But if you boil your potato in unsalted water, and this is coming from an Irish person, it reduces the potassium. So if you do really like potatoes, you can always reduce that. Or just have a smaller portion, of course. You can keep it in your diet, but just something to think about. So we've got rice and potato. Next question, which has more potassium? Lettuce or spinach? So you're trying to be healthy, you've got your salad. What leaf are you putting in it? Lettuce or spinach?
Spinach.
You think that has more potassium? Yeah?
Yes.
Okay. Interesting. So the correct answer is that, spinach has more potassium. It has a lot more potassium than lettuce, actually. Now, obviously, it's good for you in other ways, but just maybe consider how much you're putting in your salad or mix it in with other leaves. So it has about 2 to 3 times, depending on how much you use as lettuce. Next question, you want some protein. Which of these has more potassium, salmon or chicken? Okay, we've got, unanimous. Okay, so everyone's going with salmon has more potassium than chicken, and that is the correct answer. You're all doing very well. Brilliant. Better than the office. And then I think this might be, no, we've one more after this. So which of these has more potassium? So you want a little snack during the day. Is it dried apricots or grapes? It's a tricky one. Okay, I'll give you another few seconds.
I think apricots.
Yeah.
It's a very healthy snack.
Yeah. I don't want to put ideas in people's heads, the chocolate. Yeah, so the correct answer is dried apricots. And actually, this is one of the ones that, so things like dried fruits actually have an extremely high amount of potassium. So, you know, maybe a couple are fine, but actually maybe that's a food to try and avoid. So things like dried apricots, prunes, they have huge amounts of potassium in them. So, and grapes have very low. The other options in these are all low potassium if you want to look back. So that might be one to avoid. And then lastly, which drink has more potassium? Beer, wine, or are you super healthy and just drink water?
I think wine.
Okay. We'll wait, give it another few seconds. People trying to deliberate here. Yeah. So most of you are right, but it's interesting. Maybe we weren't as sure about that. So wine does have more potassium than beer, definitely a lot more. Now maybe you might just need to take less if that's all you like to drink, or this one person just drinking water is the real winner. Okay, so potassium is sort of relevant to some of you. Others might get. Let me go back to the.
Can I ask, actually, what about mineral water? So with, like, supplemented, you know, you can buy some bottled water that have extra...
Yeah, that's a good point.
I
So a
guess
lot
you'd
of
have to
those,
check the label.
yeah, exactly. On the back of the label, they will usually tell you how many electrolytes are in it, because they're actually trying to sell it to you as an electrolyte drink. So it'll actually say how many milligrams are on the back. So that's something you could take a look at. Tonic water.
That's got more.
Does it? Yeah, that's interesting. Yeah, that's something maybe to keep an eye out for. If you check the label, usually it'll say how much is in it. Thanks for that. Okay, so we'll move away from potassium. So some of you might have hypokalemic periodic paralysis, where you might get attacks if your potassium is low. And what you might have noticed over the years, or maybe even the first time you had an attack, is that it might have come after a meal late in the evening. As usually kind of quite a carbohydrate-heavy meal. So we mentioned things like pizzas or a big takeaway, things like that. So you might have had that late in the evening and then woken up overnight or in the early hours of the morning with weakness. So that's often the story we hear, but it can also happen during the day after a high carbohydrate meal. So if you have a really big lunch or something like that, you might also notice weakness shortly afterwards. And there are two types of carbohydrates. So there's a type of carbohydrates that when you take them, they release sugar really quickly, and that surges this chemical in your body called insulin. And that's a normal response by your body, and the insulin helps to use that sugar. But in someone who's sensitive to that, it can drop your potassium and cause an episode of weakness, or maybe even a mild episode of weakness or something more serious. So that's the sort of bad carbohydrate, the high GI carbohydrate. And low GI carbohydrates are just digested a lot more slowly. So while you do release insulin, you don't get that spike of insulin, which drops your potassium. So that might be a better option. And in general, we're told to eat more low GI carbohydrates, that they're better for us in general, but specifically they might drop your potassium. It's quiz time again. We're going to talk about which foods have more or less carbohydrates. Which food has more of these high GI carbohydrates? So the bad in quotation marks carbohydrate, or the one that's going to spike your insulin. So first one is white bread or sourdough. So which has more of the high GI carbohydrates, white bread or sourdough?
White bread.
Okay. I think the audience agrees with you. So, yep, you're correct. So white bread is just a lot more processed and refined, and so it's just really, it's kind of a simpler sugar, so it causes that spike, whereas sourdough is not as refined. So that might be an option, or you could just eat less of the white bread, obviously. Next question, which food has more high GI carbohydrates? So Rice Krispies or cereals, or something like oats, porridge oats, oatmeal. You think Rice Krispies? Okay. Okay. A few people deliberating. Yeah. So you're all correct. So actually things like breakfast cereals, even though they're sometimes told, sort of kind of sold to us as a healthy option, they're actually just a bit more refined, and so they do have more of the high GI carbohydrates. And something like oats can be a better option, and you can have those hot or cold. There's lots of recipes online now for overnight oats and things like that. So that might be a better option for you. Next question. So which of these has more high GI carbohydrates? Chips or chickpeas? Okay, that's locked in. Yeah, so you're all correct. So obviously, you know, that's something like a bowl of chips or fries, whatever you want to call them. You know, will spike your insulin and might cause a low potassium attack. That's great. Okay, and then what's the correct answer? Now, which of these has more high GI carbohydrates? So something like dates or cherries. So this might be one. Okay, you think cherries? So which are you going to have? A handful of dates or a handful of cherries? Yeah, so interestingly, the answer here is, yeah, most of you guessed correctly, dates. They actually, they're quite, if you think about it, quite sweet, and they do have more of these high GI carbohydrates. And cherries actually have a low amount, so those are alternatives. But you can see how, as you get to more kind of obscure foods, maybe that you don't have every day, you might not think really or kind of know the carbohydrate content of them, but you can always look it up or just have a small amount of any new food rather than lots at once. And then finally, which of these drinks has more high GI carbs? Beer, wine, or you only drink water?
Beer.
Yeah, exactly. You're right. So it's the opposite. It's the other way around. Wine has more potassium, but beer has more carbohydrates. So that's just something to bear in mind when you're choosing your drink. Your drink of choice. So I think that's it for me, but essentially just to say that, I mean, I know a lot of you know all about your food triggers, but if there is something new that you haven't tried before, maybe have a quick look, or if you're having lots of attacks despite being on medication, maybe it's something like your diet and a food diary could help. And then obviously this is how you can contact us. So because I mentioned Mixilotine, that's just our email address if you need a new prescription. That's our email address if you have any questions, or if you want to ask any of us about food triggers or send us your food diary. And then that's the QR code for our website that we talked about before.